are listening to Mariam Makwanda live on Salam Media.
You are listening to the Mariam Makwanda Show on Salam Media. And if you've just joined us, Assalamu alaikum, peace be upon you, and welcome to the show. Hearing loss is the condition that results when any part of your ear isn't working the way it should be. To tell us more is a speech therapist and audiologist, Aisha Casoojee. Assalamu alaikum, Aisha.
Wassalam. Jazakallah for having me to chat to you again, Mariam.
Afwan, it's a pleasure to have you on. Now, Aisha, what are the types of hearing loss that can occur in the life of an adult?
Okay, so there are many types of hearing losses. I think before we delve into that, I'd just like to touch on what you said just now. So yes, a hearing loss is the inability to hear, but what we need to understand, it can be the total or the partial inability to hear. And that can be related to speech sounds and environmental sounds around us. When we talk about the types of hearing loss, there are three main types of hearing loss. If I have to go into the explanation of that, it kind of becomes a little bit more scientific. Maybe what we can discuss are the causes of those types of hearing losses and the symptoms, if you don't mind.
Yes, please go ahead and discuss.
Okay, so in adults, obviously, it's an acquired hearing loss, and there can be many reasons for those hearing losses. The first category essentially would be not due to any underlying health diseases. And the second category, if we can call it that, would then be due to health conditions. If we talk about hearing losses that's not related to any underlying diseases, these could be things like having too much earwax. And in this instance, if the wax is actually impacted in a person's ears, it would affect their hearing to some degree. For this, then it would make sense that you would have to have the wax removed from your ears. And this can be done at a clinic, at your GP, at an audiologist, or an ENT as well. Another cause of hearing loss in adults that's not due to any underlying disease is the exposure to noise. Noise exposure can be, essentially it's exposure to prolonged noise or very, very loud noises. And this can be due to employment, where you work in a very noisy area for prolonged periods of time. But also more so in today's day and age, we find that many people use earbuds or the earphones, and they are listening to things over the phone or from their laptops for prolonged hours during the day and at an increased volume. And this can actually cause a hearing loss in adults. Other causes, I think I'm going to skip to the medical causes or related to health conditions. When we talk about adults, one of the categories, and related to what you asked me earlier, is called a conductive hearing loss. And these hearing losses are actually caused by middle ear infections. It can just be from recurring ear infections where there's a lot of pain. And essentially what happens when a person has an ear infection is they have pussy or fluid buildup in the middle ear. During these periods of time, they can actually experience a hearing loss. But if these ear infections are recurring, it can actually lead to a permanent hearing loss. And if someone out there feels that they're experiencing or that they have many ear infections, I would then recommend they actually see an audiologist and then their ENT to try to prevent a permanent hearing loss from developing. Going back to what you asked me earlier, then we have what we call a sensory neural hearing loss. And this is usually where we have damage to the inner ear or to the nerve that takes sound from the ear to the brain. A very common cause of hearing loss is a hearing loss caused by aging. And unfortunately, most people start experiencing symptoms already in their 40s. And as they age or as they get older, the hearing loss then progresses and the degree or the severity then worsens. So if you suspect that you have a hearing loss, I would recommend, again, have a hearing test as soon as possible, because essentially, even though we can't reverse a hearing loss, we can try to prevent the progression of the hearing loss by identifying the symptoms. I think also when we talk about health conditions or related diseases, especially in the older population, we see that unfortunately a lot of people have things like diabetes and hypertension, cholesterol. In diseases like this or in health conditions like this, especially in your hypertensions, some medications have hearing loss as a side effect. Whereas if you have uncontrolled diabetes, cholesterol, or hypertension, you can actually then develop a hearing loss, because in these medical conditions, there's actually damage that's been caused to your blood vessels and your nerves. And this can then cause a hearing loss if those blood vessels or nerves are the ones that innervate the ear itself. Then there's something else also called otosclerosis, and this is an inherited disorder. So as you can see, in adults, there's lots of causes of hearing loss. And essentially, if one has a hearing test done or conducted, we are able to then differentially diagnose what the cause of the hearing loss is, and then we can treat it appropriately.
All right, Aisha, please stay with us. We're going to take a quick break and we'll continue when we return.
Africa.
Welcome back. You are listening to the Mariam show on Salam Media, and today we are talking about hearing loss in adults and what causes it with a speech therapist and audiologist Aisha Casoojee. Aisha, shukran for staying with us on the line. And before the break, you spoke greatly about the types of the hearing loss that one can get, and you also mentioned that earwax can be a contributing factor to ear loss. So, hearing. Now, how often should our ears be cleaned from the wax? And should this be done medically? Should we go into a doctor to get the procedure done? Or, just something simple at home, taking a cotton swab and cleaning our ears?
Mariam, I'm actually very glad that you asked me the question. So essentially, it's not about having our ears cleaned. We should have our overall ears and hearing assessed on an annual basis. And this is usually done by an audiologist. Unfortunately, some people's ears just produce a little bit more wax than others. The number one rule is do not use cotton buds. They're actually not made to clean ears. the ear is developed in such a way where it produces wax to protect the ear, but it also then pushes the wax out by itself. So essentially what you should be doing is after a shower, just using a warm towel or warm face cloth to clean the outer part of the ear. The saying goes that nothing smaller than your elbow should be pushed into your ear. I would recommend that if you feel uncomfortable or if you have discomfort and if you think that it may be due to earwax that's in the ear, that you have it assessed by a professional, I would avoid doing things like ear candling. I would avoid using things like earbuds or cotton buds. Do not stick anything into your ear. Rather have someone look at the ear and either an audiologist, nurses at the local clinic, your ENTs or your GPs can then remove the wax. So the way it's done, often we use a sweet oil to soften the wax, and then ear irrigation is then done to remove the wax from the ears. Essentially, some people have to have earwax removed once every 3 months. Some people have to have it removed once every 6 months or annually. It just depends on the individual, but rather have a professional to have a look and then advise you further.
Wow. I mean, I think till today, many of us are still cleaning our ears with the cotton buds. And in fact, some of us call them earbuds because that's what we do. We stick them into our ears and pull out the wax. And I don't know that we're not supposed to do that. Wow.
Not at all. Not at all. The other thing is if you push something into your ear, you actually put yourself at risk of actually puncturing or perforating the eardrum. Because the eardrum is a very thin, small membrane at the end of the ear canal. And if you do that, you can actually then cause a very serious problem or even a permanent hearing loss after that. So do not stick anything into your ears.
Yeah, guys, do not be sticking anything into your ears. And if you have little kids as well, keep things as far as possible out of reach for them. Because when they see you sticking earbuds into your ears, they're going to be doing the same and
they definitely will.
They can into their ears. Now, Aisha, when we talk about hearing loss in adults, what age groups are we talking about? Is there a specific age that's more at risk, or are we all at risk of hearing loss?
So essentially, we all are at risk of hearing loss. Sometimes it has to do with genetics, okay? So if you're predisposed of developing a hearing loss and then you have other factors contributing to it, you can actually develop a hearing loss much earlier in your adult life. Like I mentioned earlier, noise exposure, where we're using the earbuds or the earphones and we're listening to music or to sounds at very loud levels for prolonged periods of time. Studies have shown that that hearing impairment is now occurring in your younger adults, so in the 20 to 30-year-old population. In terms of aging of presbycusis, we see that that's often from your 40-year-olds upward. And if it has to do with health-related issues, essentially it could be at any age. So the myth that, like very old people are the only ones who develop hearing losses is definitely untrue. And by having your hearing screened or tested at least once a year, you'll be able to identify a problem early enough and then try to implement some preventive measures from it progressing or getting even worse.
And we know that and younger kids are exposing themselves to hearing loss or damaging their what do you call it, eardrums? Yeah, because
their ears, essentially. Yes,
headphones and stuff, you can't even talk to them because they cannot even hear you, and sometimes you can hear what they're listening to, and it's like,
it's very loud.
And how is it diagnosed? Is there a special device that is inserted into the ear to figure out what type of hearing loss it is or the extent of the damage?
Yes. So essentially, so for example, if a patient comes to see me, I would assess and look at every part of the auditory system. The first thing that I would have to do then is look at the outer ear, look at your ear canal to assess whether there's anything physical or any blockages in there. Then we assess using specific equipment. We would assess the middle ear, and that's to identify if there are any middle ear problems or ear infections that could be related or causing a hearing loss. Then we have a soundproof booth, and the patient essentially sits on the inside. They wear a set of earphones, and the patient is then responding to sounds heard. We test different frequencies, and we try to ascertain the threshold or the intensity or the volume that the person is able to hear at. So it's a diagnostic test, and once we're done with the series of tests, we are able to say whether it's conductive, caused by something in the middle ear, whether it's sensory neural, like I mentioned earlier, if it's aging or health related, and we are then able to then treat the hearing loss. A full diagnostic test usually takes between 30 minutes to an hour, depending on any additional tests to be done and where it's done.
And I remember when you go for your driver's license, whether it's the test, the first time or to renew it, you do actually get that diagnostic ear test, and you have to control whether it's right or left, whether you can hear it or you can't hear it. And I guess that's one test that we can do when we are renewing our driver's license.
Yes.
Now, earlier on, you mentioned that it cannot be reversed. So how is it treated?
Okay, so most hearing losses can't be reversed. If it's, example, an ear infection, and if it's just once off and during the bout of an ear infection, you have slightly decreased hearing, we're hoping that once the ear infection is resolved, that your hearing goes back to normal. But if you have a permanent hearing loss now, that unfortunately cannot be reversed, and we can treat it in many ways. The most common form of treatment, obviously, are hearing aids. A hearing aid is a small device that's placed either in the ear or behind the ear. And hearing aids essentially amplify sound. So we are trying to enhance speech clarity by dampening noise levels in the environment and thereby allowing the person to be an effective communicator. For people with more profound hearing losses, we have what we call implants. So this is done in theater. They undergo an operation or they are in surgery. And you have what we call cochlear implants, where the actual cochlea, we implant a device in the actual cochlea, which is the organ responsible for hearing. We have what we call bone-anchored hearing aids. So those are also implants, but for different reasons. Sometimes people just need to go into theater. Perhaps ENTs need to do something on the eardrum or something in the middle ear, and that can also be a form. Once you out of theater, we are hoping that the hearing returns to normal levels. But if it's irreversible, most likely hearing aids. I think people also have this misperception that hearing aids are really big and they're always whistling and they look really ugly. And that prevents a lot of people from going in and getting the help or the assistance that they need. But what we don't realize is it's 2020, technology is really advanced, and people are more aesthetically aware of things. So those factors shouldn't prevent you from going in and seeking assistance.
And not just that, but now that it's 2020, it's the age of technology, it's the age of influencers. So once people see you rocking your hearing aids, people will be like, okay, if she can do it, that so can I. So it becomes like a trend now. So
yes, definitely.
Stop focusing on what people are saying, and we should stop focusing on what people are going to say and rather go and seek the necessary assistance. Now, speaking about all of these implants and devices, they obviously have come at a price. Is it affordable treatment?
So obviously in South Africa, we have public healthcare and we have private healthcare. 85% of our population actually accesses public healthcare. And yes, the treatment, the assessments and the treatment is available in public healthcare as well as in private. you would get essentially the same standard and the same type of service in both sectors. It would be up to you whether you belong to a medical aid or not to then seek your assistance publicly or privately. Obviously, in both instances, it comes at a price. For patients who attend public healthcare, they are on a classification system according to their income, which obviously is a little bit cheaper than private healthcare. And if you do belong to a medical aid, or if you're completely private, it does come a little bit at a price because it is technology that is involved as well. Yeah.
And one more thing, do they need to be changed every now and then, or once it's inserted, then it stays on for a while?
Okay, so a hearing aid essentially should last a few years. Hearing aids, I need to stress, cannot be bought over the counter. Preferably, they shouldn't be bought secondhand. They shouldn't be passed down generation to generation or from cousin to cousin in families, because hearing aids are actually chosen according to an individual's type and degree of hearing loss. And then an audiologist programs it according to that hearing loss. The hearing aid itself comes with a warranty. It doesn't have to be changed for a good couple of years, but there are battery costs that are involved. So most hearing aids, batteries last about 2 weeks, essentially. 2020, like you said, the year of technology. In the last 2 months, there's been a lot of launches with rechargeable batteries for hearing aids. So I think that's more, the route to go, where patients can then save on costs in the long term. Yes.
Yeah, and I think that puts people at ease, especially now with this pandemic, and money is not easy come as it was a few years earlier. So
yes, definitely.
Can you please share your contact details with our viewers and listeners in case anyone might be interested in contacting you?
Sure. I can be contacted on my cell phone. That is 071 359 2575. I have a Facebook page, which is the Speech Therapist and Audiologist. I can be found on Instagram as well. And my practice is in Johannesburg South, and that's in Ridgeway on Rifle Range Road.
All right. Shukran so much for your time and for the knowledge, and have a wonderful day.
Thanks for having me. You too. Assalamu alaikum wa rahmatullah.
Walaikum salam wa rahmatullahi wa barakatuh. That was Aisha Casoojee, speech therapist and audiologist, just taking us through hearing loss in adults. And as she mentioned, the ages are getting younger and younger. It's no longer the 60s. Instead, it's now as young as 40. Noise pollution, where you work, could be a contributing factor. How loud your sound on your earphones are. So please be very wary when be aware when it comes to how loud you are listening to whatever it is that you are listening to. And if you would like to contact Aisha, she is on Facebook as the speech therapist and audiologist. She's also on Instagram, and you can give her a call or text on 071 359 2575 for any further questions, comments, queries, or suggestions. And you can also send them to us on our WhatsApp line. The number is 061 755. 061 766 0355. You are listening to the Mari Mukonda Show on Salam Media, and we will be right back.